Hi, it's Bruce Williams again, and as part of my series on surgical pathology, I want to share a great case that just came across my desk. The case is from a 9-year-old female spayed whippet who, on routine examination, was noticed to have a hard nodule in the area of the right anal sac. The veterinarian took a fine needle aspirate, and upon results of that aspirate, the animal was scheduled for surgery and the right anal sac was removed. And we have a great biopsy to go with this cytology. This cytology is not the fine needle aspirate, but actually is an impression smear taken at surgery. There are two impressions here, and I'm going to go the one with a little less blood because you can see what's going on just a little bit better. When I hear about tumors from the anal sac, the first thing I'm going to think about is a perianal gland or hepatoid adenoma. These are extremely common and benign tumors in dogs. The cells tend to resemble hepatocytes. That's why it gets that name, hepatoid gland, because the cells are large, polygonal, with abundant eosinophilic vacuolated cytoplasm characteristic of that modified sebaceous gland. As we zoom in here, I'm not seeing any of those here, which is a bad sign already. What I do see is a number of cells with oval nuclei which vary a little bit in size, and some of them have a moderate amount of a light blue cytoplasm. You can see that here with some greenish granules, which may represent apocrine secretion. One thing that you'll notice is most of these cells are actually just naked nuclei. The nuclei are intact, but there is no cytoplasm. And when we see quote-unquote naked nuclei tumors, we think about neuroendocrine tumors, some endocrine tumors such as those of the thyroid gland, and unfortunately, the adenocarcinoma of the Apricot glands of the anal sac also fits into this category. So a lot of the nuclei have no cytoplasm around them. I generally don't like to diagnose cells that have no cytoplasm, but when I see these many where the nuclei remain intact, I can get to a diagnosis fairly quickly. Okay, so next thing I'm going to do, because the tumors of the Apricot sac tend to form acini, I'm going to look, and it can take a while to find them. Luckily, this one has a nice big arrow by it. But if we look closely, these cells all have some cytoplasm, and they are clustered around a central area of cytoplasm, which might even contain a little bit of secretory product. This is a great acinus, and really is pushing me toward that adenocarcinoma of the Apricot gland. There are adenomas of the Apricot glands of the anal sac, but they're incredibly rare, and you just almost never see them. And if we look around a little more, these acini seem to be jumping out at us. Those arrows I put in the slide didn't hurt, but here's a nice acinus as well. And if you've seen enough of these, you might start being able to diagnose not acini in 3 dimensions. They look like little clusters or little spherules. And even if I don't see a good acinus, if I see something like this is an acinus actually in 3 dimensions. And if we were to orient it the right way and it was spread out, we would probably see in the center of this mass of cells forming a sphere, there would be an acinus or an empty space right there. I also see a lot of macrophages in this particular specimen as well. So I think there's probably some inflammation going on, which is not unusual for these particular tumors or any tumors around the perianal gland, because the animal often traumatizes them, releasing some sebum or secretory material of the neoplastic apricot glands into the surrounding tissue. So let's take a look at the biopsy. Here's the biopsy, and this well represents why the veterinarian said there was a hard nodule in the area of the anal sac. And this biopsy actually includes the anal sac, which is great. Certainly helps with the diagnosis, and some fairly normal apocrine glands on either side of the anal sac. But unfortunately, we have a large, encapsulated, well-demarcated but infiltrative neoplasm adjacent to the anal sacs and arising in the area of those Apricot glands. I don't see it actually coming off the Apricot glands, but it's in the right spot. And if we look closer, we're going to see that a lot of these cells are forming tubules. This is an Apricot tubular gland, and this would do this. So there are a number of different types of this, and the tubular version is one of the more common. There's the rosette version of this. There's one that you just get sheets of cells, and a very rare clear cell variant. But in the tubular version, these large, almost ductal structures, they're really acini, are very common. And if we get a little closer, let's go to another area of the tumor here, because we can go just about anywhere. Here's one without too many tubules. And I'm starting to see that acinar pattern. It's not great in this spot, but let's just go next door. And you can see these acini that we were looking at on the cytology pop out at you. If you want to call them acini, or you want to call these rosettes, this would be a very nice rosette, okay? The acini tend to have some secretory material. The rosettes don't, but either one would be outstanding to help you make this diagnosis. This particular tumor has a lot of desmoplastic response to the infiltrating epithelial cells, and carcinomas, whether they're adenocarcinomas or straight carcinomas, tend to incite a desmoplastic response, proliferation of fibroblasts and laying down of collagen. And if we look at throughout this tumor, and especially at the edges of the tumor, we have a pretty profound inflammatory response. Remember, we saw those macrophages in the cytology, and they're coming from these areas, which both have an infiltration of neoplastic cells. But there's a lot of inflammation here. So I'm wondering if this animal didn't have pre-existing anal sac disease, or because it was traumatizing, or maybe the veterinarian tried to squeeze this to express the anal glands. We ended up with some granulomatous inflammation at the sides. At the periphery, here's a little bit of hemorrhage right here too, which suggests trauma as the cause of this inflammation. But right in here we have some infiltrative neoplasm. So this is a small puzzle that is not that important to this dog, and we can go ahead and let that one lie, because this dog has some much more important things to deal with. One of the things that I really don't like in these tumors, I don't like any of them, but when I start to see these nests of cells far away, I wonder if this might have been a lymphatic, okay, that contains this. I can't really tell, so I'm just going to say that this is infiltration. We do have some nice inflammatory cells, especially lymphocytes, around vessels deep in the tumor. So I think we have our diagnosis here of the adenocarcinoma of the Apricot glands of the anal sacs. So they were able to get this tumor out fairly intact. It does not look like it has infiltrated the underlying skeletal muscle, and it probably got shelled out pretty nicely. We can see the whole thing here. So what does that mean for this dog? Unfortunately, I don't think that's going to help this particular dog too much. These particular tumors often tend to metastasize into the pelvic canal and to the sublumbar lymph nodes even before they are perceptible on rectal exam. Conservatively, about 80% of these will metastasize. About 70% will go to the nodes, and they may go to the lungs, the liver, or the spleen. So we're going to have to watch this dog very carefully. One of the other things that these particular neoplasms will do is they will liberate substances that mimic the action of parathyroid hormone, called parathyroid hormone releasing program. And about 30% of these animals will develop hypercalcemia to the point that they may enter chronic renal failure and present with hypercalcemia and hyperphosphatemia. This particular whippet did not have hypercalcemia at the time of surgery because the initial cytologic response on the FNA was that this was an Apricot gland adenocarcinoma of the anal sacs. At the time of surgery, a CBC, chemistry, and UA were normal. Thoracic radiographs and abdominal ultrasound were also normal, and the animal had no hypercalcemia at that time. However, if we simply play the numbers with this particular tumor, because of its high rate of metastasis, as Apricot neoplasms in the hind end of the animal will do, I'm going to give a very guarded prognosis. Well, I hope you enjoyed this particular case. I will occasionally put additional surgical pathology cases up as they come across the desk, and they are excellent examples. I hope you've enjoyed this little lecture, and that you will look forward to more lectures in surgical pathology or gross pathology of various systems or species on the Davis Foundation Facebook page and YouTube channel. Have a great day.